about your very hip joints. Dancers' hip joints are always a focus of attention, right? We always want to know, how do I get my legs higher? How do I improve the flexibility at my hip? There's a whole series on safe flexibility that you can check out for that. But really, first, you have to understand the anatomy of the hip joint. If you don't know how the hip actually works, then you're not using the right imagery necessarily to be able to get the most out of the hip without damaging it. When I was a dancer, I had no idea what the anatomy of my hip was, and I was trying to make it do all sorts of things that really the anatomy doesn't permit, and therefore I wasn't working with it, I was working against it. So it's really key to get to know how this joint works so that you can really get the maximum out of it while not exploiting it to the point of injury. Now, even if you've not had a specific hip injury, dancers are often, we get grumbly hips. Oh, they're clicking, they're sore, they're not, working, they're stiff. I'm doing a lot of videos around sort of hip issues and things like clicking hips and what that is and how to prevent it. But this video is the base video that you need before you go and watch those other ones so you understand this joint itself. Get to know your joints. Your body will thank you for it. Okay, let's have a look at the anatomy of the bones here. Now, we've got our pelvic bones. I call them the Mickey Mouse ears, right? Because they look like sort of elephant ears or Mickey Mouse ears. Those two pelvic bones sit in that hip area. We use the word hip, but most people don't really know where the hip is, and they call all sorts of parts of their body the hip. But those two bones are really the pelvic bones. And here in the middle, we've taken one of those away, facing the person, you're looking at their left hip, and we've kind of isolated that out so we can see the anatomy in more detail. The name of that pelvic bone is the ilium, and on that ilium we have a little cup. So the hip joint is a ball and socket joint, a round ball that fits into a cup like a socket, and that socket is on the ilium, and the fancy term for the hip socket is the acetabulum. It's a little depression in the pelvic bone into which the round head of your thigh bone is received. And what you'll notice with that thigh bone, it's called the femur, the bone comes up, it kind of sticks out a bit at the side, there's a knobble on it, it's called your greater trochanter. If you watch the turnout video, we'll get into that in more detail. But then the bone kind of turns at 45 degrees and goes inwards and upwards into the hip socket. So the hip socket itself is kind of, if you put your hands on the front of your groin area, that's really where this joint is. Some people think it's stuck on the side, some people think it's up by their waistline. Know how to imagine and visualize your hip joint, and then you'll be able to work with it better. So that round end of the femur, we call that the femoral head, is received into the acetabulum, the hip socket, and that's where the motion of the hip joint occurs. We call that space around where that ball and socket is. There's a capsule that goes around that. All joints have capsules around them, which is a soft tissue bag, if you like, inside which is beautiful fluid, right, that helps to oil and grease the joint so that it moves smoothly. So we call that space the joint cavity, with the joint capsule around it. There's a wide range of movement at the hip joint, and don't we exploit it as dancers? It's not like, say, a knee joint or an elbow that's just like a hinge and just kind of goes in one direction. We can get multi-directional movement here. What we need to understand is that any joints in the body that are inherently very mobile are also inherently unstable. The thing is with the hip joint is it does need to be stable because it's taking our weight. We call it a weight-bearing joint because most of the time we're standing on our feet, moving on our feet, and it's carrying our body weight. So it has to do these combined roles of taking our weight and being stable, but also allowing for a large range of movement. This is why we really need to take care of how we develop flexibility in our joints so that we don't destabilize them in the process. Watch the flexibility series of videos to know more about that. Now you'll see where the acetabulum is shown there and the femoral head, there's kind of white stuff on there. This is cartilage. Where bones meet bones at a joint, they're lined with this highly glossy, shiny tissue that's called cartilage that allows for those bones to glide around each other smoothly, and it protects the end of the bone itself. If we didn't have that cartilage, and sometimes when we damage hips, we damage that cartilage, then you've got bone on bone, and that's not a good thing. When we start eroding the bony surfaces, we're in a lot of trouble. We're into what's called arthritis. Itis just means inflammation. Arth, A-R-T-H, means a joint. So inflammation of a joint. We tend to think about it as an old person's thing, but that term specifically just means an inflamed joint. And how many times do we get inflamed hip joints? We do. Okay, so that's the basic bony anatomy of our hip joint. Here's a little more detail on the ligaments and capsule. Remember, ligaments are present wherever bones meet bone and they connect them together. Watch the Meet Your Soft Tissues video for more information on that. On the left-hand side of this picture, you'll see that joint capsule that I just mentioned. It's like this sheath, this membrane, this bag around the joint that keeps that precious fluid in there and allows also for movement. It's like an outer sleeve of the joint. We've got another layer of ligaments that connect around from the pelvis to the thigh bone. And as you'll see, they're in this slightly kind of spiral arrangement. And this is why we get this rotational capacity at the hip that we exploit as dancers to our advantage. Those ligaments are there to allow some movement so that spiral can unwind and wind up depending on which motion we're going in. So it'll allow for some movement, but it's going to stop us from going too far. Remember, ligaments are not stretchy like muscles, so that at some point they're going to act like a strap and go here and no further. You shall not pass. However, as dancers, we tend to exploit this, and some of the aggressive stretching techniques that people use around their hip joints damage these ligaments, and now we've got, guess what, an unstable joint, and we're into injuries. And also it's increasing your risk of problems later in life, like even after your dance career is over. I always say I'm here as an advocate for your older self, and I want to make sure that your older self thanks you for knowing this stuff now so that you protect these hips going forwards. Let's have a look at some of the muscles. Now, muscles that flex the hip, when we use the anatomical term flexion, we're really meaning when you bend your thigh bone up towards your body. So bringing your knee up towards your chest in any range of motion is a hip flexion motion. If it's kind of front around to the side, we've got a degree of hip flexion going on. There are certain muscles that do this for us or activate that motion. On the left-hand picture there, we see the tensor fascia lata. That's a little muscle. If you find the knobble of your pelvic bone on the front there, and then run your fingers just down below it, you'll be into a pad of soft tissue. And then if you bring your knee up to your chest while you've got your fingers in that spot, you'll feel that TFL, as we shorten it to, contracting as you bring your knee towards your chest. Underneath that, we've got one of our quadriceps muscles. So the quadriceps, if you want more details on the quads, watch the Meet Your Knee Joint video, because most of the 4 quadriceps muscles, there are 4 muscles that make up that group, 3 of them just act on the knee joint, so I use more detail in that video. One of them, the rectus femoris muscle, crosses up and attaches to that pelvic bone, just below where that TFL attaches, and therefore it is one of the hip flexors. So one part of your quad muscle is a hip flexor as well. On the far right of this picture, we see the psoas. It's kind of a funny name because it begins with a P, but the P is silent. The psoas muscles, a lot of dancers talk about them, but they often don't really know where they are and what they're doing. What we're looking at there is the front of the body, and we've taken away your abdominal muscles, we've taken away all your internal organs that are sitting there as well behind your abdominal wall, and we're looking at the sort of inside of your spine. So everything that's behind all your organs, underneath there sit these beautiful psoas muscles. You might also hear this muscle referred to as the iliopsoas. As we've seen with various different muscles in the body, often two muscles blend together and attach at a common point, and therefore we put them together as a group because they're working what we call synergistically. They work as a team. We've got the psoas major, which is the main one we talk about when we're referring to the psoas. And you can see it's coming down and it's attaching to all the lumbar vertebrae, your lower back vertebrae of your spine, being attached into by these muscles. Obviously, we've got a right one and a left one. You'll also see there psoas minor, which is kind of a little separate muscle belly, as we call it. Some people have them, some people don't. Some people have one on the right, they don't have one on the left, and vice versa. So they're sometimes present, not always, but they work just like the psoas major. They're just like an added helper. They're coming down and it actually attaches, that little minor one, you can see at the bottom there, it kind of attaches onto the rim of your pelvis. So it's crossing the spine, but it's not crossing down into your leg. That psoas major, you can see it swoops down and it attaches on the inside top part of your thigh bone. So just sort of below the groin area at the top of the inside of your thigh attaches there. Therefore, it acts to bring the thigh bone up towards the spine, but it also does the opposite. It brings your spine towards your leg. So if you think of forward bending, it's involved in that too. It's also involved in the angle of the pelvis. And when we get on to spinal alignment, we'll be talking a lot about this psoas. So it's one of the hip flexors, but its job is really to stabilize your spine for that leg to come up. If your psoas isn't working very well and you try and bring your knee to your chest, you often drop your back down towards your knee. You collapse into it. You'll also notice another muscle there called the iliacus. Remember, the ilium is that pelvic bone. The iliacus is a muscle that's attached to that bone, and it actually coats the inner surface of those Mickey Mouse ears. It comes down and it blends with that psoas major muscle, and they have a shared tendon. Remember, muscles end in tendons. A shared tendon that attaches into that upper part of your thigh bone on the inside. Therefore, again, they work as a team. So that's why it's often referred to as the iliopsoas, because it's the iliacus and the psoas blending together and becoming one structure. Another muscle that's worth mentioning here, as it's also a hip flexor, is the sartorius muscle. The word sartorius comes from the Latin word for tailor, and it's known as the tailor's muscle. Tailors were known historically for sitting with their legs crossed, just like in this picture here. And the sartorius muscle is the muscle that gives us that action. I mentioned it's a hip flexor, just like the ones we've just looked at, but it also slightly abducts the leg. That means takes the thigh bone away from the middle of the body, and also externally rotates, which is our turnout. So you can see how it will put the leg into that cross-legged position. And typically this is what we're using when we're going up into that retire position and going into développé and extending our legs. It's the longest muscle in the body too, and it has this ribbon-like shape and almost a sort of S-shaped alignment coming from the knobbly bone on the front of our pelvis there, and it's lying on top of the quads and comes around the inner thigh and attaches below the inner thigh onto the tibia, the shin bone, on the inside part of that. So you can see, again, if you want to put that inner part of your tibia onto your pelvic bone, you're going to have to do that sort of turn out retire position to achieve that motion. It's a very thin muscle, so you often can't feel it on top of the quads, but it is there. It just sort of blends quite seamlessly into it. But that's the sartorius muscle. On the back of the leg, we've got muscles that do the opposite. Remember, muscles work in paired groups. Hamstrings, again, I go into a lot of detail of these on the Meet Your Knee Joints video, so check that one out for more hamstring detail. But because the hamstrings begin collectively, remember there are 3 muscles in this group, they begin on your sitting bone. Your sitting bone is part of that pelvic bone, and it's the bit that when we're doing floor work, when we're sitting, it's the bit that points straight down towards the floor, and that's where these hamstrings attach. When we're talking about the hip, their job is to extend the hip. That's the opposite of flexion in anatomical language. That's lifting your leg up to the back. Arabesque, right? Whether it's parallel, turned out, those hamstring muscles are involved in lifting your leg up at the back. But they're also, one of their main jobs really is to bend your knee. But watch the knee video for that. Also, they help a little bit with hip rotation because one of your hamstring muscles, which is called the biceps femoris, we're looking at a right leg back view here, it runs down the outside of your thigh bone, whereas the other 2 run down the inside of your thigh bone. Therefore, the outer one is a little bit more involved in turn out, and the inner ones are a little bit involved in turn in. So they actually have a role. They're not primary movers of hip rotation. We're going to look at those in a moment, but they are kind of helping. Remember, muscles never really do just one job. It depends where our foot is aligned, how much turnout we're in, as to how many muscles are getting involved. But when you look at the hamstring stretch video, I'll be showing you how to refine the stretch so that you can target the outer one or the inner ones in case you've got discrepancies there. Remember, we want all muscles to have equal tone when they cross a joint, otherwise that joint gets unhappy. Other muscles that are involved in hip movement, the gluteal muscles, the glutes as we often call them. Most people know the gluteus maximus, right? It's the big muscle on the buttock area. It's beginning attaching into that sacrum, which is the triangular bone that sits in between those 2 Mickey Mouse ears of the pelvic bones, and it swoops across around to the outside of our thigh bone, our femur. Now, it's a big muscle and it has fibres that kind of are in different orientations depending on where our leg is in space. So it kind of has a mixture of actions depending on the angle of your leg. Is your knee up by your chest? Are you in a standing position? But its main job is to lift the leg to the back, hip extension. It's also involved in a little bit of external rotation, and it's also involved in abduction. Abduction, if you think of you abduct something, you take it away. Lifting your leg to the side, for instance, would be abduction. Underneath that, if we take that away, we've got another muscle, a deeper glute muscle called the gluteus medius. Medius means middle, and it's a little smaller, you can see, and it runs again from the sort of crest of that pelvic bone down to that bit of your thigh bone that pokes out to the side. And its job again is abduction, so when you're taking the leg away from the midline of the body, but it's involved in internal rotation, turning in. Go and watch the turnout video and I'll talk about how this muscle can really sabotage our flexibility and give us what I call the dead end développé. You know, when you can kick your leg that far, but you can only get it up to a certain height lower when you're trying to hold it. It's often because you're recruiting that gluteus medius muscle and it's wanting to turn your leg in while you're trying to turn it out to get it up in the air. And you get into a little bit of a battle with your own hip joint there, which is not helpful. Watch the turnout video to find out more about how to not do that. So those are 2 of the glute muscles. We also have a gluteus minimus, but I'm not including that here because it's not really a primary mover of the hip. So those are our glutes. Inside thigh muscles. Talk a lot about these as dancers. Their fancy name is the adductor muscles, adductor. We talked about abductors taking something away from the body, moving something away from your midline. Adductors move towards, they add in. These are the muscles that are on that inner part of your thigh. They're starting up just in front of the sitting bones, coming down, and they have this sort of fan-like arrangement that attaches them all the way down along the inside of the thigh bone. Now, there are different sort of strands to these adductor muscles, so we call them different names. At the top there we have the adductor brevis. Brevis just means short, and it normally means that you've also got a long one called the adductor longus. And then there's another one called the adductor magnus, and you can see that one comes all the way down to just above our knee joint. It's the one you can feel if you prod just above your knee joint on your inner thigh. So they're a big fan of muscles that span that whole midline area of the upper leg. They're opposing the motion of those glutes. Remember, the glutes have that abduction motion, so these ones are adductors, so we need these to be in balance with each other. These need both flexibility because of the silly things we do with our hip joints as dancers, in that right-hand picture being a good example. They need to be flexible to allow us to get into that position. Obviously, they're being stretched as you go into that position, but they also need to be able to fire and have strength in that extended position. This is one of the unique things with dance because of the range of motions we work in. We don't just want muscles that are like, oh, I'm kind of loose and floppy and I can swing my leg up here. We need to be able to activate the muscle up there, A, to be able to hold an extension, but B, to also protect the joint underneath. And we're talking about the hip joint in particular here. Therefore, we are really needing to build flexibility hand in hand with stability. Again, watch the Safe Flexibility series, and I'm also doing a conditioning series where we look at how do we build flexibility and strength together. These adductor inner thigh muscles, I'm sure you've all experienced it, prone to overstretching injury. If you kind of fall into the splits, if you whack your leg up in the air and you weren't warm and that muscle, you get a muscle tear. Go and watch the muscle injury video to see what's going on when we do that and how to best help those recover. But we need to be mindful these muscles need to be flexible, but they also need to be strong. We're going to look at the turnout muscles. Now, how many people really know where their turnout muscles are and what they do? Because certainly myself as a dancer, people used to throw this term around, use your turnout muscles, use your turnout muscles. And I was like, I have no idea where they are. I know they're roughly in the kind of buttock area, so I would just grip everything in that area and hope for the best. And all I was really doing was gripping out the glute max muscle and not activating what we call the deep six muscles, because there are 6 little muscles at the back of the hip that we really need to be recruiting for our external rotation of the hip. If these guys are not being used and they are therefore weak, we tend to start over recruiting that gluteus medius, which you can also see there in this picture sitting above them. And that's when we get into terrible territory because it's an internal rotator and we need our external rotators fired up. So what we've done in this picture is taken away the glute max muscle, which is over the top of all of this, so we can see these deeper guys underneath. There are 6 of them. They've got crazy names. You don't need to remember them all. You just need to know that there are 6 little guys here that are doing our turnout work. You might have heard of the piriformis muscle because it's one that is talked about a little more, and it's the largest of these groups, and it's also a unique one in the group of 6 because it starts on your sacrum, which is that triangular bone you can see there at the base of the spine. It actually attaches to the front part of that, the bit that's facing away from you in this picture. And then it comes across, it's kind of spanning diagonally across that glute area, the buttock area, and attaching into the thigh bone at the top of it there. You can see it it's just dipping under that gluteus medius muscle, but you can see roughly where it's headed. The other 5 below it are all attaching from the bottom of the pelvic bone, so around the sort of sitting bone area, around the upper part of it, they're attaching to that bone, so they're not connected to the spine. They're on the back of the hip. We're looking back view here, so you can imagine, again, I said if you want to know what a muscle does, try and put its two attachment points together. So where you see all those muscles attaching onto the thigh bone, if you move that thigh bone towards the attachment on the sitting bone of the pelvis, that leg's going to want to rotate outwards. Go and watch the turnout video and you'll see me taking a dancer through this and finding that turnout motion, because it's very different to what a lot of dancers are doing. Let's have a little closer look at that hip labrum. This is an area that can get damaged as dancers, and it can even get torn, and there are some dancers who even have surgery to repair this. We don't want to go there, right? And we don't need to if we know how to avoid annoying our hip labrum. I'm going to do a whole video on labral injuries, but let's just have a look at the anatomy so you understand what it is and what its role is. We saw before that the hip socket, that acetabulum was the fancy name for it, on the pelvic bone, has a cup in it, that depression that receives the head of the femur. But the labrum, remember we talked about cartilage layering the surface of those joint articulation surfaces, so the inside of that hip socket has cartilage lining it. The labrum is sort of an extension of that comes out beyond the bony level of the hip socket. Therefore, it creates a deeper cup. So the labrum's main role is to deepen the cup of that hip socket, which helps increase the stability. If something's very shallow, then that thigh bone can be rattling around in the cup. So the labrum is there to just give a slightly deeper, it's almost like it's got a little sleeve that it can fit into now. But because it's soft tissue, it's still allowing for that motion. If you just had a deep bone cup, you wouldn't be able to move the leg very much. So it's kind of like a little kind of skirt, if you like, that's deepening the cup of the hip socket, allowing for some movement, but also improving stability. You'll actually see there, it says labral tear, and actually this diagram is showing you how you can get little tears in that labrum. When you're getting pinchy hips, when you're doing extensions, and you get that kind of catch in the groin, sometimes, not always, but sometimes that can be an indication that we're pinching and nipping that labrum, and therefore over time, most of these sorts of injuries, you don't typically tear your labrum in one moment. It's normally something that you've been pushing that hip, you've been pinching that hip, you've been crushing, pulling your hip into the socket and not moving it well, or you've been forcing movement into a particular angle of your hip joint. That labrum's starting to get worn and worn and worn and frayed, and the fibres are fraying, and the body will try and fix that and mend it. But if you keep annoying it, I always say it's a bit like a bruise. If you get a bruise and you keep sticking your finger in it, you're going to keep having a bruise, right? If you keep annoying these tissues, they keep fraying, and eventually we're starting to get a more serious injury. Listen to the little murmurs, the whispers in the body. Then it doesn't have to yell. When you're getting severe pain, clicking, or even kind of instability at that hip joint, you're at the shouting stage of the symptoms. Listen to the whispers, make sure you understand the anatomy, and stop annoying the area that is giving you good information. My mantra, there's never anything wrong with the body. Any symptoms you experience are the body telling you something needs to be taken care of. That soft cup labrum is also there for shock absorption. If you've watched the foot video, the ankle video, the knee video, I always talk about shock absorption. The feet are the primary shock absorbers. When we're landing from a jump, they're absorbing that, what we call the ground reaction force that echoes up the body. The hip also needs to absorb the shock before it hits the spine. That labrum is also there to help absorb some of that shock because it's made of soft tissue. Prone to impingement, as I've just mentioned, and watch the labral tear video and we'll talk more in detail about how that tends to occur. Dancers who are hypermobile, whole video series on hypermobility, we call that joint laxity as well. Remember, flexibility is instability. If you are whacking your legs around and they're moving a lot, that can create more friction in the joint and it can nip this labrum more, and you might be more prone to these sorts of injuries. You need to be stabilizing the hips, not exploiting by doing aggressive stretching exercises. Aggressive stretching of the hips can damage the labrum as well. Watch the Safe Flexibility series. Question dancers always want to know, how do I improve the flexibility at my hip? What limits that? We all know that some dancers are super flexible, other dancers not so flexible. Is it something you're born with? Is it something you can improve and develop? These are the things that dictate how much flexibility you are going to have at the hip. Now, you have to be honest with yourself. If you lie to yourself, then you're more likely to get yourself into injury territory. Be honest with yourself, know what you've got, and work with it, not against it. The shape of that hip socket, that acetabulum, I mentioned before, some people are a little bit more shallow, some people have quite a deep hip socket. The deeper the hip socket, the more stable it is, but the less flexible it is. Some people just naturally have a deeper, bony hip socket. Therefore, there's a point at which their flexibility is going to meet an end point that will go no further. That's something you can get assessed by a medical professional to see what you have available at the hip. Similarly, the shape of that, what we call the femoral head, the round bit at the top of your thigh bone, is different shapes. Some people have a much more exaggerated round, some people is slightly flatter, and again that will dictate how much motion is available at your hip socket. I mentioned the Mickey Mouse ears. If you think of the hip socket as being the hole in your ears, some ears point more forwards in some animals, right, and some point more round to the sides in some animals. That can also be the case with our hip sockets. Some hip sockets point in a more forward direction, some point more to the side, and again, the ones that are more side-facing give you more flexibility. If yours point forwards and they're deep, you're going to be one of those people that has less flexibility at the hip, but you're going to be more stable and less prone to injury. There are payoffs for all of this. There's no right or wrong way. It's just a question of knowing what you've got and working with it. That's the bones. We also can have restrictions depending on the laxity of what we call the connective tissue. So watch the soft tissue video to know more about that. But we've talked about ligaments, the joint capsule. Those, depending on the laxity of those, if you're more hypermobile, there's more play in those. So those might be dictating, allowing more flexibility or restricting flexibility for you. Again, that's not something we want to modify. The bones we can't modify. The ligaments we shouldn't modify. We can annoy them, but we don't want to. Then we've got the tension of the surrounding muscles. We just saw all the muscles that are around the hip. If you've got a lot of tension in those muscles, that will restrict your hip flexibility. Think about your hamstrings. If your hamstrings are tight, your leg doesn't go up so much. Those are things that are modifiable. By working with safe flexibility training, watch that series, you can improve that flexibility and therefore improve the hip joint range of motion. So we talk about modifiable things and non-modifiable things. The bones, the ligaments, non-modifiable, or we shouldn't modify them, or we shouldn't attempt to. The muscles and tendons we can modify to a certain extent, but making sure we're doing that safely. All right, that was a whistle-stop tour of this very lovely joint that we really need to get to know. Make friends with your hip joints, get to know them, then you can work with them, not against them.